the Public Relations and Communications Specialist at Canada College. We have an interesting webinar ahead for you, but first, it is important we begin by acknowledging that we are in the Robinson-Huron Treaty Territory, and on the land which belongs, the land on which we are gathered is the traditional territory of Nipissing First Nation. We'll begin this morning's session with a welcome from George Burton, the President and CEO of Canada College. George?
Thank you, Cindy, and good morning to everyone, and thank you for being here. This is an understatement, but COVID-19 pandemic has caused and is causing chaos in our lives and in our work. That brings on stress and anxiety for many of us. Today's webinar will be helpful in identifying the signs of stress and worry, and then provide some advice on how to cope. The webinar series is open to individuals of all ages, our students, our faculty, adults, and especially frontline essential workers. And the frontline essential workers joining us today, a tip of the hat to you for all that you do in keeping us safe and sound. Today's initiative is in line with what we call The Village, a world-class health and wellness facility that is student-led, that's fostering a spirit of collaboration between community-based services, cultures, and people of all ages. Launching this webinar series is also timely, as Canada has recently launched its new student mental health and well-being strategy. Everyone's mental health and well-being are what we're looking to protect and improve during these sessions. So again, thank you for participating. I hope you enjoy the presentations. I know we'll be better as a result of participating today. Thank you, everyone.
Thank you, George. Now let me introduce you to our first presenters. First, Dr. Sanjeev Sucklingham is a professor and vice chair of education in the Department of Psychiatry at the University of Toronto. He is also the vice president education at the Centre for Addiction and Mental Health and the psychosocial director for the Toronto Western Hospital Bariatric Surgery Program at the University Health Network. He is currently the co-lead for the Extension for Community Healthcare Outcomes, Ontario Mental Health and the Centre for Addiction, and Mental Health at the University of Toronto, which is a provincial hub and spoke knowledge sharing network model building mental health and addiction capacity in rural Ontario. And Dr. Alison Crawford, who is the co-chair of the ECHO Ontario Mental Health. She is a psychiatrist and assistant professor, Psychiatry, University of Toronto, where she is the director of the Northern Psychiatric Outreach Program and the Telepsychiatry at the Centre for Addiction and Mental Health. She has worked as a psychiatrist in Nunavut for 10 years. Her research focus is on outreach and transcultural psychiatry, including issues related to access and equity, cultural safety, collaborative and community-based care, and technology. Doctors, the floor is yours.
Great. Thank you, Cindy, for that warm welcome. Again, on behalf of Alison and myself, we're both very ecstatic to be here to be able to talk about this important issue. I'll hand it over to Alison if she wants to say a few words as well.
Thanks, Sanjeev. Good morning, everyone. Sanjeev's going to take the first turn, and I'll circle back afterwards. Okay. But it was great to be here.
Great. Thanks, Alison. So again, I think it's again a great opportunity for us, and thank you for joining us today to be talking about mental health and resilience, especially in our current context. I just would like to say that I hope that all of you will be able to take away a few points of and insights about how we can both help and support each other, but also pay attention to our own self-care during this time as it relates to managing some of the stress, anxiety, mental health issues that are quite common during COVID-19. We'll also share some resources with you, which I hope you'll be able to also take away to either use or share within your networks. And then we'll also, lastly, we'll actually have some experiential opportunities to actually start to practice and use some of these skills in today's session. With that, maybe what I'll ask is if Alison can put up our slides. We have some slides which we'll go back and forth on. Thank you, Alison. And Alison's going to be advancing the slides, which I greatly appreciate. So thank you, Alison, in advance. Again, our focus today is on resilience and resilience in your context. And again, we'll be covering a range of topics over the course of this session. I'll just go to the next slide. And just state that we have no disclosures. Some of the work that we're going to present on have been part of a research initiative, but largely have been part of the work supported by CAMH and the University of Toronto. And our learning objectives, again, as identified, will be to identify stressors of self-care strategies and identify stressors and self-care strategies, discuss challenges and the impact on families as well as individually, and so thinking more broadly and how we can manage some of these unique circumstances as has been highlighted already. And then explore strategies for wellness and dealing with anxiety and mental health. And we'll talk more broadly about mental health and wellness throughout the course of our session. So our next slide. So I just want to highlight, this is a slide that Alice and I have often used to talk about the pandemic. It's from SAMHSA. It's been used in other contexts, whether it be crises or natural disasters, other pandemics previously, and really has been an opportunity to reflect on what's common with our experiences during COVID-19, but also some of the unique components related to this pandemic. So just highlight these stages because I think it's an opportunity to reflect on how what we're going through is somewhat similar to some of the things that people have experienced globally in the past, but how our current context is somewhat unique. So as you can imagine, when something like a pandemic hits, there's pre-disaster anxiety, uncertainty, which many of us can think about as we reflect on February and early March before we had the declaration of our global crisis related to COVID-19. And again, that can bring up a lot of anxiety, a bit of panic in that state. The impact of a disaster pandemic definitely has its effect. And then you see people moving into heroic states. So, our essential workers, individuals in healthcare, really going above and beyond, fueled by that adrenaline and that common purpose to help others around us. We see that heroic phase again. The honeymoon, where we see that there's been some progress, stability. We can think about that in COVID-19 during our summer, where we had a little bit of kind of decreases in our trending downwards of our cases, lessening of some of our restrictions, kind of hope and optimism that perhaps, we're moving forward. There's then a disillusionment after that phase, when there's kind of an initial one-time disaster or one-time kind of episode or wave of a pandemic. And disillusionment can be the setting in of mental and physical fatigue, starting to now get back to try to understand our new normal. And then we see some of the mental health concerns kind of creeping in during this time. And it's not a kind of straight line. There are trigger events, things and stressors that might emerge. And then usually we see a period lasting a year or more of kind of reconstruction. With the kind of SARS pandemic, we saw it kind of more protracted, several years, where people were kind of trying to understand, especially if they were in the front lines or directly impacted. And sometimes anniversary events, when there's a unique date or a date of loss or tragedy that might then precipitate further anxiety, depression, and other mental health concerns later on. Allison, if you could click one more for me. This is kind of our state. We're kind of making up the curve as we go. COVID-19 has not been like many other pandemics or disasters that we see. And so we use this phased approach to understand the highs and lows of pandemics, but we are kind of in new territory with COVID-19. We've had, again, that pre-disasters I talked about. We can all remember kind of the concerns and panic, hoarding kind of food, groceries. Toilet paper was a hot commodity early on. Again, we see many heroic peaks, whether it's in our kind of first wave or second wave currently. And again, we're hoping for this honeymoon phase and some progress along the way, but there are many periods of disillusionment which can kind of start to wear down and cause fatigue and mental health distress for many of us. So again, just underscores how we can see how things might be kind of progress for us, but also that how there's a lot of uncertainty and unknown in our current context. All right, next slide. And so what do we know about the actual trends about mental health and substance use in our current context? There are many studies that have been done globally, a lot of data that emerged from China given the timelines, and some from Europe and then the United States, and some emerging throughout Canada. This is data from a partnership of CAMH and Delvinia, which have started a series of surveys with general public. This is across Canada, several thousand individuals who've been filling out surveys at different time points to take a kind of quick indicator of mental health issues as well as substance use during this time. And this data is more recently from the September data that shows that, again, 21% of individuals reported moderate or severe anxiety in the last 2 weeks in September. About a quarter of individuals engaged in binge drinking in the past 7 days. 20% expressed they felt lonely in the past 7 days. And then 21% expressed they felt depressed in the past 7 days. And what's interesting is that we saw in the kind of previous data points a decrease in some of these numbers in the summertime in the July data. And then again, a trend upward in September. And we do have another kind of repeat coming up shortly, which I suspect will be slightly higher or at least the same in terms of the data, just based on what we're seeing, what we're hearing, and some of the impact around us during COVID-19. All right, next slide. And I hope you can see this, but this is a kind of a snapshot from that survey, which also delves into kind of key areas. First, we see which age groups are being more impacted. We see those who are 60 and above have kind of had a decreasing trends in their moderate to severe anxiety, but we see a little bit of a U-shaped type of curve. You can imagine the U there forming, but kind of peaks in May, some improvement over kind of late May, June, July, and then an increase now in September. And again, you can imagine some of the reasons why, such as kind of people thinking about resuming their regular activities after that honeymoon phase, in addition to managing COVID-19, the increase in cases, of course, children going back to school, people kind of resuming some of their work during that reopening initially. So a lot of those concerns kind of percolating in terms of some of the anxiety in those younger age groups, maybe students going back to university, colleges, all of those being a factor. We see a gender difference, that there's kind of a slight kind of view for females more so than males. And then those who had children in the household, again, if you had kids, you started off with more anxiety in the May data, some improvement again, and then it's starting to creep up, although you can see some increases in both groups during this time. All right, next slide. And then just if we took it another one, financial worry, again, another concern that is driving a lot of the mental health kind of distress. And we see those who had kind of financial worries, again, very worried about finances is the top line, somewhat worried is about the middle line, not very worried. And you can see the level of anxiety being correlated or associated with your finances and anxiety. And similarly, infection concerns also correlated more so with those who were very worried that they were related somewhat to also reinfection concerns as cases started to increase during this time. All right, our next slide. And so just want to show you about mental health conditions in patients with COVID-19, healthcare workers, and then we also have family and friends. So again, this was from China, and this was after their kind of their first wave, I would say a little bit in their honeymoon or disillusionment phase in that curve. And you see that acute stress, that's kind of sometimes predates post-traumatic stress type of symptoms, depression, anxiety, and insomnia, very common for patients, obviously people who are COVID-19 positive, who are in healthcare settings. HCW's healthcare workers, again, they were much higher early in the pandemic. At this time, still high, in that about 30% approximately across the stress, depression, anxiety, insomnia domains. And then family and friends of individuals in this context were again around 30% as well. And so again, you're seeing again higher levels of mental health conditions, symptoms, and concerns, and some of the kind of vital symptoms like insomnia and sleep being significantly disrupted during this time as a result of mental health distress. All right, next slide. In addition to mental health distress, we can talk about substance use and alcohol use. I showed you the data from the survey data from CAMH and Delvinia that showed kind of increased rates of binge drinking. And this has been noted throughout the literature in several research studies about the increased rates of alcohol use or dependency or harmful use, males being at slightly higher risk. And interestingly, when exploring the reasons why people were drinking more, women tended to drink more for stress, and men tended to drink more for boredom, and that's on self-report. And again, 1 in 5 Canadians have had increased drinking throughout most of the kind of pandemic, starting in May 2020 data from the survey, as well as other surveys nationally. All right, next slide. And here's a slide just looking at how kind of work and unemployment factors into mental health. We know that suicide is a rare occurrence, but a serious and significant complication of mental health and mental illness. And again, it's a marker of severity and endpoint in our population. And although the kind of rates of suicide per 100,000 are around 11 per 100,000 in Canada, this is a extrapolation of how this might be, the suicide rates might actually change based on unemployment rates, that's UR. And so if there was minimal changes, you see kind of us staying pretty much the same in terms of our rates of suicide across, this is in Canada. If there's a moderate increase in unemployment rate, we see kind of a further increase. And then if there's kind of extreme increases in unemployment rates, again, a substantial shift in the proportion of individuals dying by suicide. And again, you see that's the kind of percent increase, and you can see a 28% increase in kind of more extreme cases. So again, I think it really highlights how unemployment and kind of job security and availability of kind of financial support plays a significant role on mental health and more serious complications and adverse events related to mental illness. All right, next slide. And there are many risk factors for distress and mental health concerns. Healthcare workers, those directly involved in COVID-19 care are obviously very much at high risk, as I've shown you, having a friend or family ill with COVID-19. People who have pre-existing mental health or mental illness can obviously have increased risk of developing mental health concerns during the pandemic. Socio-demographic factors, females being at higher risk, being single or more socially isolated. Student status, and that could be due to kind of concerns about development, finances, and some of the other variables that I've mentioned. And then health factors, if people have physical symptoms like sore throat or cough from other chronic medical conditions, that they may be more likely to have more distress during COVID-19 for many, there are obvious reasons that they may have concerns about developing, either being more susceptible, or maybe that these are symptoms that are developing as a result of infection from COVID-19. And again, if you've had poor reported physical health, maybe increased vulnerability being a factor. And then past exposure to traumatic events. And this has been kind of a surreal experience for many people, and as a result, cause significant adversity, and as a result, may be triggering for some people who've had past traumatic and stressful events in their past. All right, next slide, Allison. And then there's more recently some data that really highlighted a bidirectional relationship between COVID-19 and psychiatric illness. You may have seen this paper come out about a week and a half ago in the news. It really was a study that looked at, in the United States, across 50 plus healthcare organizations who kind of pooled all their health data into this major database. And they were able to look at COVID-19 and whether or not it was related to psychiatric illness or disorders, and also people who had psychiatric disorders were at increased risk of developing COVID-19. They compared it with other health conditions, acute health conditions like other infections, kind of gastrointestinal conditions that were more needed immediate care. So it's a good comparison. And what they found is that new onset psychiatric illness occurred in 18% of people who were COVID-19 positive, nearly doubled the risk compared to other conditions. And interestingly, that was not related to the severity of COVID-19. So they actually looked at people who were hospitalized for COVID-19 versus those who weren't, and showed that the rate seemed relatively stable. And that those who had a psychiatric disorder or history had increased risk of developing COVID-19 by about 65% increased risk. And that was partly related to, hypothesized to be related to multiple factors, although they couldn't identify exactly the reason why, but possibly due to kind of socioeconomic variables, difficulties adhering to public health requirements as a result of their psychiatric illness or associated complications, as well as perhaps there are some biological variables, because inflammation has been a factor in psychiatric illness and also is elevated in the context of COVID-19. And so there might be some biological mechanisms as well. I would say that when we think about the new onset of psychiatric conditions related to COVID-19, much of that was anxiety, depression, insomnia, and to a certain degree in individuals who were 65 and over, kind of onset of dementia was also increased in the population as well. And again, we're happy to talk a bit more about this study, but I think it highlights the bidirectional relationship between COVID-19 and psychiatric illness. So I think these studies and the research has shown that mental health is important for us to kind of monitor and pay attention to during COVID-19. I think everyone on this this seminar today can relate to that, underscore, and appreciate how it's important to underscore this with our friends, family, and coworkers. But also that we need to also think about how do we better support each other during this time, and how we might be able to address and prevent mental health distress or psychiatric illness developing during this time as well. So with that, we'll go to the next slide here. And I know I can see comments flashing up about resiliency, and I think Allison will be covering that, about teaching resiliency or developing resiliency or harnessing resiliency in our next few slides. But I wanted to make sure that we weren't, Allison and I want to make sure we weren't going to be doing a lot of talking, and we can actually practice some of the components of self-care and resiliency in our current context in this seminar. And what I'd like for people to do here is that we're going to actually do an exercise for a mindful moment. We just talked about mental health and how we need to monitor, and this is an opportunity for us to take a few moments this morning to actually practice how we might be able to build that into our day-to-day. So I'd like for people to kind of take this moment as they're participating in this webinar to kind of settle into a comfortable position, kind of open themselves to this experience and this opportunity to kind of partake in this mindful moment. Many of you who've done mindfulness this might be very easy for you. And for those, if this is your first time, just hope that you kind of open yourself to this experience, reflect on how it may or may not be helpful in your context, or how you might be able to use some of these components. So again, just maybe take a moment, get settled into your chair. If you're standing, maybe in a comfortable position. If you feel comfortable, maybe close your eyes or keep a soft, unfocused gaze, a few feet in front of you. Maybe become more aware of how things are at this moment by deliberately adopting a straight posture, whether you're sitting or standing. I just want you to, again, if you're closing your eyes, great. If you're looking forward, that's also okay. Just focus your attention on your breath, noticing your very next breath, kind of breathing in, and then your breath as you breathe out. So again, just focusing on your breathing in and then breathing out. And following your next breath in, and then your out breath. Continue to breathe at a steady and kind of relaxed pace. And as you're breathing, just bringing your awareness to your inner experience, acknowledging it, asking yourself, what is my experience right now? What thoughts are going through my mind? As best you can, acknowledge thoughts as mental events, perhaps putting them into words in your thoughts. Try not to follow your thoughts, just notice them. Notice what feelings are here. You can turn towards sense of if you've had discomfort or unpleasant feelings, just acknowledging them. You could label them. You could be labeling them as I'm feeling happy right now, I'm feeling anxious or tense. What body sensations are you feeling? Just do a quick scan of your body, pick up any sensations, tightness, tension. Again, just acknowledging these sensations. Try not to judge the feelings or sensations as good or bad, just notice them. Continuing to breathe in and then breathe out. Then redirect your attention and focus on the physical sensations of your breathing in. Moving close to your sense of your breath in your belly, in your abdomen. Feeling the sensations as your abdomen's expanding, as the breath comes in, falling back as it goes back out. Notice your breath through your nose, filling your throat, your upper chest, your lower chest. Follow the breath all the way in and all the way out, using your breathing to anchor yourself in the present. And now just expand the field of your awareness surrounding the breathing so that it includes a sense of your body as a whole, your posture, your facial expressions. Continuing to breathe in and breathe out. If you become aware of any sensations or discomfort, tension or resistance, take your awareness there by breathing them in on the in-breath and then breathing them out from those sensations, softening and opening with the out-breath. Continue to do so, just breathing in, again noticing, breathing out. And as I continue to kind of ask you to continue to breathe, just open your eyes gradually. And then bring yourself back to your current present. Again, reflecting on kind of that breath. And as best you can, just hoping you can bring that expanded awareness in the next moments for the remainder of your day. And with that, I'll hand it over to Allison.
Thank you so much, Sanjeev. Sanjeev and I do a lot of teaching together in a virtual environment, and we've started to incorporate mindfulness often, which seems a little counterintuitive. We're all sitting in our own little spaces, but I have found it really personally very helpful, although I have to wake myself up to give the rest of the talk, but thank you for that, Sanjeev. All right, so I'm going to talk a bit more and practice some strategies here to address some of the challenges that Sanjeev has outlined. You know, some of the anxiety, some of the down or gloomy or even depressed feelings that many of us are struggling with during this time. And I noticed in the chat, the idea of resilience came up. So resilience is a word we use a lot, very commonly. And it's an important word. There have been some important critiques of the idea of resilience over the last years, especially the idea that it all rests on the individual. So when we think about resilience, I'm going to talk about individual level, but also how the family and community and how our institutions can support resilience as well. But when we think about our own ability to be resilient, there's a definition up here, but really there are two main components. It's about in the face of something difficult, how can we make a positive adaptation to that? Resilience is something that we don't just learn once, at some stage in our life and then have forever. It's really an ongoing process. That idea of continual adaptation. And we all know that sometimes in our lives, we've felt more resilient and sometimes less resilient, but there are very practical things that we can do to kind of shore up and boost our own resilience and then help those around us to boost their resilience. This is work by Bruce Perry in the US, and I really like the way that he has talked about resilience as this dynamic process, but also stress. So resilience does involve, it's not usually something that we develop or build in times of calm and ease. It's something that we kind of build up when things are tough and we make those adaptations that builds up our resilience. So stress is something that, we all talk about being stressed and in a kind of negative way, but stress is just a thing. Stress and a certain amount of stress is normal. We go through different kinds of stresses all day. The stress of working, the stress of being tired, the stress of making dinner while kids are screaming, making mortgage payments. All of those things can be stressful, but it's really the adaptation that we're able to make to that stress that determines whether it's harmful or helpful in the form of resilience. So here are two different patterns of stress that you see on this graph. So when stress is unpredictable or very extreme or goes on for a long time, that's when it can really make us, there's a process of sensitization and a kind of wearing away at us and can make us vulnerable. On the other hand, if we can make stress more predictable, more moderate, if we have a greater sense of control over it, then that's when we develop tolerance and resilience. And on this next slide, these are some ways, and I'm going to talk about specific examples and actually walk us through some. But if we think of this graph on the left, and you can see the resilience kind of tilts more towards stress being chaotic, severe, prolonged, and uncontrollable. If we don't have a lot of structure, if we're using coping strategies that only add to our stress, getting exposed to too much media. I don't know about you guys, but in the beginning of this pandemic, I was constantly flicking the channels, trying to check out what was happening, or the US election, any kind of stress where we're really exposed to upsetting media. Becoming too sedentary, not getting exercise. There's lots of evidence that exercise is very helpful to managing stress. And becoming isolated. And you can hear in there the resonance of all the things that we've been struggling with during the pandemic. On the other hand, if we add structure back in, if we connect, if we get exercise, we get sleep, those kinds of things can shift our way of dealing with that stress to make it more predictable and controllable. And I'm going to go back to that because we're going to walk through some of those basic ways to do that. I do think it's important to acknowledge, though, that not all members of our society have the same ability or the same circumstances is a better way to put it, to move the dial on their own stress. That sometimes people are dealing with circumstances like poverty, homelessness, feeling marginalized, they're in environments that feel unpredictable, where they might be experiencing violence. And that can really make it hard. That's why we're seeing some of those differences in people's ability to be resilient. And that's why we also need to think about community level factors when we think about resilience. There are the kind of basis of being able to manage stress, though, and you see that in the outer circle here, is to feel a sense of safety and security. That can be in our physical self, so being able to take care of our own basic needs, being in safe housing, a safe community. And then once we have that foundation, we can build on our sense of connection to others. We can look at how our thinking impacts our stress. We can pay attention to our emotions, and even build a sense of spirituality, optimism, even in the face of difficulty. I'm going to go through some of these things in a more practical way in a moment. I mentioned family. So we know that the evidence shows that there are family factors that can lead to people within the family being more resilient. So leadership within the family, a sense that the members have that there's a sense of collective security, guidance, having at least one supportive relationship within the house, and having routines, rituals, rules that really give that sense of calm and order and predictability. And then within our communities, and I think this event really highlights the importance of community. So when there is an emphasis on social support, when there's a normalization of the fact that people feel distressed, that they need to come together, that they need supportive tools, when we have policies where we put resources into communities, that can all have a very positive impact on resilience. So let's get practical. These are, actually Sanjeev and I keep joking that we keep adding C's: compassion, comedy, creativity. There are lots of ways of coping, but here are 4 really basic things. So I'm a psychiatrist, but you do not need to be a psychiatrist to introduce coping strategies into your own lives, to support your kids, your neighbors, your friends, your colleagues with ways to cope during this pandemic. These are all evidence-based, but they're all also quite simple. So I mentioned that sense of a controlled, having a sense of personal control in your environment and over your stress. And part of that is recognizing what we can do to help ourselves during these times. Taking care of our own basic needs, a sense of coherence. This will make more sense in a second, but really thinking about how we're thinking about the pandemic, how we're thinking about our own stress, and recognizing those kind of stories that we tell ourselves. We're going to go through some exercises in a moment. And really importantly, connectedness. We all have that need, and no time, more than now. And there's lots of evidence to support that if people are feeling isolated, if they become isolated, then some of those things that Sanjeev outlined, the anxiety, depression, can become much worse. So here, when we think about the C of care, we need to attend to our own basic and essential needs. That's, what we're eating, getting exercise, and getting sleep. It seems like we should have nothing but time for sleep right now, but I don't know about everybody, but this is something I really learned early on, that I was working very, very long hours at the beginning of the pandemic, not getting enough rest, and feeling almost like there was no barrier between work and sleep and home, and it was all kind of blending together. And I just wasn't sleeping. And it really made it very difficult. I started to notice my own stress really creep up. Nutrition, obviously very important. Lots of jokes out there abounding about pandemic comfort eating, but it can really also decrease our resilience. And exercise, same thing. Lots of good evidence that getting exercise on a regular basis can build up our resilience and is very good for mood. So if you are feeling stressed, this is actually a really good place to start. Some very simple things that you can do. And when we think about a sense of control, I'm going to go into some cognitive behavioral techniques in a minute with some practical examples. but really recognizing where we're at, our feelings, thoughts, and behaviors can be really helpful at gaining that sense of that you understand what's going on, that you can control it. Again, I mentioned this already, but being aware of the information that we're taking in and what that does to our thoughts and our feelings and behaviors. And engaging in pleasurable activities, taking the time for those things can also be mood boosting, and even better if it's with others and makes you feel socially connected. Okay, I'm gonna skip over this slide. This is also very helpful. I'm going to put it all together in a moment in a nice, easy triangle, and we'll go through some examples. But paying attention to your mood. So sometimes we don't, we feel down or we feel anxious, and we don't really acknowledge that to ourselves. But measuring it, getting a sense of it, following it over time, helping those around us. If you have a family member who's struggling with low mood or anxiety, this is a tool called the GAD-7. It's widely available on the internet, but it can really help gauge, first of all, it shows you the different ways that anxiety manifests. So from feeling kind of nervous or anxious or on edge, to having difficulty relaxing, feeling restless, and then also some of the thoughts, being afraid, unable to disconnect from your thinking. So this is a kind of self-monitoring tool that can really help you follow your own mood and anxiety along, and give you a greater sense of control and perhaps when to seek more help. That's the other thing. Although we're talking about kind of everyday tools that people can use, there are people who are struggling with more severe symptoms, and to encourage ourselves and those around us to reach out if people are really struggling with depressed mood or anxiety that feels unrelenting. And of course, if people have any thoughts of not wanting to live or suicide, we also want to encourage people to to reach out, because those things are preventable, and there are mental health resources in our communities. So just to acknowledge, even though we're talking about everyday coping, sometimes that can get out of hand for people, and they may need more professional help. All right. So here we go. Let's do a couple of examples. This is the cognitive triangle, and anyone who's ever worked with me as a patient gets very sick of the triangle, and my children for that matter. But it's very helpful to kind of put some of these things together. So I want you to stop and think about, and you got to get really specific when you use this. Think about a time recently when you felt, let's go with a more positive emotion first. When you felt good, you felt either content, peaceful, happy, whatever you would call it. Think about what was happening for you at that time. Where were you? Who were you with? What were you doing? And then you can start this triangle once you get used to doing it on any of the 3 points, but we'll start here on the affect or the mood part of the triangle. So in this specific time when you were feeling good, what would you call that emotion that you were feeling? Peace, contentment, happiness, joy, okay, whatever word you would call it. Then pay attention to where you felt that in your body. If you can bring yourself back into that situation. So sometimes we feel a lightness, we might feel a glow, we might be smiling. Kind of do a scan head to toe. What did you feel in your body? What did you call that emotion? And we also can think about those emotional or affective states on a kind of scale. So we all know times where we felt like giddy, joyful, like maybe you just felt like over the moon, and you felt it in your body as a sense of bubbliness and excitement, and you were smiling, and it was a 10 out of 10. Or maybe it was just pleasant, like you just felt like I felt nice in that time, and it was maybe like a 5 out of 10. So you can see you can do quite a lot of work on this corner of the triangle, and just tuning into your feelings, where you feel them in your body. And Sanjeev was inviting us to do that during the meditation. Meditation or mindfulness is a very good way of being able to do that. And in that pleasant moment, what were you thinking? This is the part that can be a little trickier and take a bit more practice. But so I'm going to give you a personal example. This weekend, I took my kids. The city had a flu shot station outside, because they were using physical distancing and following all the public health regulations, so that the clinic was outside and it was down by the lake in Toronto. And I found myself really feeling really good that day. And I was looking around, and if I'd had to tune into what was my emotional state, it would have been really happy. I would have used the word happy. And if I had to start attending to what my thoughts were, it was something like, wow, it's such a beautiful day. It's so nice outside. Oh, we might as well go for a walk while we're here. Isn't this, we're all having a good time. It would have been thoughts like that. So it's almost thinking about your thoughts as you would see subtitles on a movie screen. What's going through your mind at that time? And the behavior, what did I decide to do about it? I decided actually in that moment to stay out longer, to go for a longer walk. And that in turn gave me more joy and more sense of satisfaction. So in that example, you can hear how these things work together. Now think about a time when you didn't have such a positive emotion. And I could use an example. This isn't what happened, but say I had gone for the flu shot, same conditions, and I'd had a thought, oh, we're all getting sick from this pandemic. What's going to happen if the flu comes around? I hate getting flu shots. They cause so much pain. And then what if I had thought, you know what, I'm actually not going to line up and get the flu shot because it's going to hurt and I can't deal with this. And then what if I had gone home? That would have made my anxiety probably worse. So you can see in any situation how these things drive each other. So when we think about, this is what we mean by a sense of coherence, understanding our reactions to things, understanding how putting a label on what we're feeling, seeing how it's connected to our thinking, and then understanding how that makes us choose certain behaviors or ways of coping. And we can turn that cycle around at any one of these 3 points. We don't want to encourage people to, you can't just change your feelings, but you can notice them. And you can look at your thinking and also try to shift that a little bit. So if I had been in that situation where I was thinking this whole pandemic is, it's causing us all to be sick, it's awful, I could have thought, okay, hang on a second, Allison, you're really, this isn't helping you. It's making you want to go home. It's making you very anxious. How can you challenge that thinking? And that's where I would have thought something like, well, at least I'm doing my part by getting the flu shot. And there's support within the city for us to get our flu shots and to try to keep everyone well. And they're doing it outside to try to help with public health measures. So you can see how as soon as you start to shift those thoughts, then you can go back and think about what you're feeling in that moment and see if you can turn the dial around. In order to do that, and actually I put this slide that Sanjeev referred to earlier here, because you can think about in every part of this curve is a little story. So in that honeymoon phase, what would that triangle look like? What would the feelings be that go with that? How are we thinking when we think we can do this, we can beat this pandemic? What do we do about it? We get together, we do, drives for food for people in the community who aren't coping as well. And you can see how that triangle would have a really positive spin. In this valley of disillusionment, thoughts might be, this is going on forever. I've lost a whole, year of my life. I haven't seen my loved ones. That's another point about doing that cognitive work. It's not about saying that the thoughts are true or false. I mean, sometimes they are, sometimes we exaggerate our thinking, but sometimes they're true. So a thought like, I haven't seen my loved ones in a year, actually could be very true. But there are ways of nuancing the thoughts or recognizing that when we get stuck in those thoughts, it can really be associated with negative emotions. Okay. And really the narrative is ours to write, I think is and both individually and as a family and collectively. So here's just some little reminders to, I call these pulse checks. So all the things that we mentioned that you can do, it's not something that you should save up and go to a spa and do for 3 weeks straight. It's something that we need to do multiple times a day, kind of literally check in with ourselves. How are we feeling? What do we feel in our body? What's happening with our thinking? And what are the choices, the behavioral or action choices that we're making that can drive that triangle in more distressing ways or can in more positive ways for us? And Sanjeev's going to go over some resources. This is one I thought I would mention. If you like technology, Woebot, I do not have shares. I wish I had shares in Woebot. But I have found this incredibly helpful. It is, you know, if you don't want to invest and go see a therapist and do cognitive behavioral therapy, this is freely available to download. Woebot's a little robot guy who I've actually become quite fond of, that takes you through some of these cognitive behavioral strategies in really nice little bite-sized chunks, like 5 to 10 minutes a day. And I think for teenagers, it would probably be very helpful as well. But I will turn it back over to Sanjeev just to go over some other resources.
Great, thank you, Allison. So I'll just go over a few resources, and then I guess we'll stop for some questions after that. Allison's already talked about a bit of some of the strategies that we can use and some of the skills, and really reinforce that for us, it's really about how do you manage this on a day-to-day basis. And much of this is preventative or early intervention. There is that continuum of mental health, and kind of distress, and then mental illness. And we want to do all our best to so that you know, Allison and I are not the ones seeing people for help. We want to help people upstream. So really with prevention and early intervention. And so with all that we've talked about, and knowing that, you know, 20% of Canadians are experiencing anxiety or depression during this time, we want to capitalize on any resources, and here's digital, but any accessible resources that people can use. And I'll talk a bit about what might be available, especially during these times where kind of face-to-face may not always be accessible based on public health kind of restrictions and how we're managing the pandemic. So I'll go to the next slide. Just want to highlight that on our camh.ca website, there are many resources, but the one that Alice and I are very familiar with is our CAMH resources. There are resources, one for the general public on COVID-19 and managing mental health. And within that, you can see there, it's the website below, that there are some really practical tips. Much of what we've been talking about has been distilled in various toolkits, kind of short paragraphs. And here's one example that Allison's put up, which is kind of challenging worries and anxious thoughts. You can read it really quickly here and just see that, you know, really practical tips about noticing and catching those thoughts, how you might be able to identify and challenge it, exactly that triangle that Allison was talking about. You know, how do you know it's true? How do you cope with the end result? And thinking about consequences of kind of letting go of the worrying, you know, what it does for you, what it, how it's impacting you, and then reassessing whether this process has been helpful in changing how we might be thinking about our anxious thoughts or worries. So again, that's one example of one of those tools. And again, they're very kind of short descriptions with some handouts that people can use, and you can share that with colleagues, with your family or friends. And so a good way to kind of engage in some of these discussions, and a good script as well. All right, the next slide. And all of this is also, there's, the big question, is there an app for that? And there is an app for that as well. We see here, this is the CAMH, that website distilled into a app that's available on Android and Apple Store. And again, freely accessible, that highlights a lot of the resources, what is COVID-19, but more importantly, related to our presentation today, how do I manage stress? And how do you manage some difficult conversations, set boundaries? How do you get help for yourself or others? All of that is summarized in the app, and again, it's based on the website material. All right, and the next slide. And then Allison, myself, and Jillian Strudwick, as well as a great team, has been that we have the pleasure of working with, kind of put together a list of digital mental health tools and interventions. This was supported by CIHR. And really, this is a database to look at, and we evaluated digital mental health interventions for supporting Canadians during the pandemic. And I basically would say that this is useful if you need to go search for specific tools or websites. There is a kind of library of resources, and we are adapting this, and hopefully in the next month on the camh.ca website, we'll actually have a more advanced search function for you to scroll through and search for resources, whether it be related to anxiety or mood or wellness, and also for specific populations. For example, there are a few Indigenous specific resources, few resources for youth, for example. So definitely for different groups and different needs, we're hoping that this will help curate and highlight some of those really helpful resources for people that they could use online. Again, early on in this intervention, we want people to get access as many ways as possible that they can access these resources through. All right, next slide, Allison. And here's an example of what that looks like currently. And so there's the app, description of it, what it actually does. So this first one here, the CAMH one, is about psychoeducation and peer support. There's some that have tracking of mood and symptoms in there, as well as mindfulness activities. So again, you get a flavor of what each of the apps and websites have in terms of some of the resources and interventions. And again, we will have more categories and breakdowns in our advanced search function that will be really shortly. All right, and the next slide. And then for those of you, I see some questions that we'll get to about first responders and people working in healthcare. Allison and I have been involved with ECHO Ontario Mental Health for the last 5 years. And during the start of the pandemic, we decided that we needed to think about how we adapt this ECHO model, and I'll briefly talk about it, to support people working on the front lines who are kind of taking care of patients and families. So this is targeted towards healthcare workers and anyone working in the healthcare field, and it's called ECHO Coping with COVID. ECHO is a tele-education kind of virtual community of practice where people gather together who are kind of taking care of patients or working in the healthcare field with a hub team that's made up of individuals. For this particular ECHO, Alice and I are part of the team, but other psychiatrists who have a focus on wellness, infectious disease specialists, nurse, as well as other healthcare professionals and kind of guest presenters. We share kind of best practices through presentations, but a lot of discussion, and usually ECHO has patient case discussion. In this ECHO discussion, it's about our personal stories and experiences. And so we do end up sharing information. We do mindfulness briefly. We have then sharing of how people are managing and kind of resources, tips, and just an opportunity to be able to express feelings in a very safe and supportive environment, as well as art of coping, which is our great way of sharing ways people have used to build resiliency, kind of managed stress in their own context. So again, this is for healthcare providers to register. However, people, anyone, because they're publicly available, can go to the website, look at presentations, and review those resources. There is a great library corner by our CAMH librarian who's put together resources and articles and tips that are open access for individuals to use. And there's a YouTube channel, which we're updating, a little bit behind, but we'll be updating new videos, including to give you a flavor of what the sessions look like, but also kind of those best practices and tips and skills are shared through the kind of YouTube videos, which are also open access and available freely for everyone. Echo is free for people who are in healthcare. So that's just another, just a reminder that you can join us on Friday afternoons, and it's now a national network that we've been able to form, which has been really exciting and rewarding. I have to say, Allison and I often talk about how we're privileged to be part of this, because we get to kind of focus on our mental health and self-care with many others, and we learn so much from one another during these sessions. All right, I'll go to the next slide. And that's our summary. So just again, that I hope you've had some information to open up those discussions, maybe awareness or new insights in how mental health, wellness, resiliency all fits together during COVID-19, and that interplay between those concepts. We've talked a bit about self-monitoring and how we might be able to do some preventative or early interventions that could be widely used without a psychiatrist or accessing resources, professional resources, but many resources that are available to the general public and to kind of essential workers and those working on the front lines. And again, hopefully you take away our 4 C's. Maybe you can add a couple extra C's to that concept as well, but we do think it's a start in terms of how we might all try to address mental health, specifically anxiety and some of the mood and other changes that we've had to experience during this pandemic. So again, hopefully it's been useful for you, and we're really excited to engage in our discussion. So thank you.
Your presentation, doctors. The information was very helpful, very useful. We will now have some time to take some questions from the participants. You can ask your questions, submit your questions through the chat feature on the Zoom. Our first question, I can take the answer to that one. Will the slides be shared? Yes, they will be shared at canadacollege.ca/webinar. Doctors, the first question, and you can both take a shot at it if you'd like. As it pertains to self-care, I have a dear friend who recently became the primary caregiver to her mother who was quite ill. She gets 30 minutes a day and 3 hours every 2 weeks off. How do you advocate self-care to someone in this situation?
Sanjeev, are you?
I mean, I can start. I think it's obviously quite challenging during this time, especially given how services have been rolled back or delivered virtually, which obviously is a different experience and may not meet the needs of everyone. So I just want to acknowledge that those are obviously quite challenging circumstances and unfortunately common during our time, given some of the limitations. I think to think about how we might approach that, one is thinking about the networks and supports that are available right now. And so, thinking about when someone's the primary caregiver, are there other family members or supports that might be able to be involved in care? Is there any advocacy that could be done with health teams or community services that might be useful in terms of increasing supports and communicating that to the team involved that might be part of the care team more broadly? I would also say that for kind of primary caregivers, important to have that open discussion about self-care and thinking about rotations or schedules in which to have those breaks to attend to self-care during that time. I think thinking about our 4 C's, having control over that and care are important pieces that would be important to try to focus on, and we need time for that. And so are there, is there someone that can come in for a couple hours to provide some help or support with the primary caregiver in that context to allow for that individual to attend to his or her own well-being and care during that context. So that's a kind of couple of C's and thinking about how we might be able to attend to that, but I'll hand it to Allison to add further.
I was doing the same thing. I was going through the C's. And I would add one that we didn't talk about, which is compassion, including self-compassion. So when I talked about that triangle, your friend may not be able to change anything about the situation, but even kind of understanding, what is his or her thinking during those moments? What is he or she feeling, and what do they choose to do about it? And just looking at ways to even have pleasant events or activities with the person that she's caring with, but also to acknowledge some of the tough feelings. This is too much, or tough thoughts. This is too much for me. I have no help. I feel overwhelmed, are all thoughts, and attending to the feelings, because even that coherence can really help, and kind of self-acceptance and compassion about where they're at. But I also noticed the question about resilience and can it be taught? And this taps into it. Yes, those are all strategies that can really help build resilience, but this really speaks to the community level of resilience. If we don't invest in care for seniors, if we don't, provide that respite care, if we don't come together as families and as communities to make that happen, it's really hard on the individual to stay resilient during that. So if there are any politicians on this this seminar, invest.
Okay, the second question. Now, and Dr. Crawford, I know you spoke about resiliency. The question, can resiliency be taught? I'm wondering if there's something else that maybe you could reiterate that, someone could use in terms of building resiliency?
I think just to even get at the heart of the question, it can be taught, but concepts like resilience can also be stigmatizing for some of the reasons that I've talked about. Because if someone's not able to cope, or they are having a hard time, it doesn't mean that they haven't done the right things necessarily, or that they aren't a resilient person. Sometimes when people experience a lot of adversity, especially early in childhood or throughout their lives, or if they struggle with a mental health illness, it's very hard to just be resilient. But definitely the strategies that we talked about can help build that in anyone, even people who do struggle with their mental illness or their mental health. So I would say it's all the things that we talked about, really trying to get a sense of personal control, taking care of oneself, using those 4 C's, and also reaching out for help if you aren't able to do some of those 4 C's for yourself or for your family.
Thank you. The next question, it feels like the world has changed overnight. What steps should we take to adjust when the world returns to a new normal?
That's definitely for you, Sanjeev.
Well, I think, again, this is a bit about predicting into the future a little bit about what that kind of new normal will be. And I think that comes back to that curve that we talked about in terms of pandemics. I do think that, once we're through COVID-19 and whatever that new normal may look like, I think, again, I see the comments there that people really reiterated the investment in resources and supports in the northern communities. And I would say we probably need to invest in mental health supports and resources and programming, especially community-based, during that time, because I do think there's going to be a lot to process given the peaks and valleys that we are going through with each wave and the experiences. And so, you know, how do we adjust to that post-pandemic new normal? I do think it's really about, again, paying attention to our kind of well-being and how we are coping and managing, especially if that adrenaline's run out and the fatigue that people might be experiencing after going through all this. There's a lot of loss and unprocessed grief too, and early on and at different times during the pandemic with restrictions. You know, in my practice, there were many patients who really struggled with not being able to attend funerals for loved ones who may have passed away due to COVID-19 or unrelated to COVID-19 during the pandemic, just because of that distance and not being able to have those usual experiences or traditions that allow us to mourn and process grief. So there'll be likely some of that might precipitate. The economic burden and consequences is likely to have an impact on individuals and their families. And so we need to be, again, supporting more holistically in determinants of health and social needs, as well as attending to then mental health to support people as they're trying to get back on their feet after the pandemic. So I think all of these are, you know, pointing towards a multi-pronged approach of kind of community-based basic needs and our determinants of health. And then, of course, mental health is critical to that in terms of support for people to process all the things I've talked about, but also support people in terms of their growth and resiliency and well-being.
Okay, thank you. The next question, what about people who live alone? So many people are suffering in silence. So how can people who live alone help themselves?
Yeah, we know when Sanjeev showed a slide showing some of the risk factors, and certainly people who live alone are potentially at increased risk, because I think they have to work harder to make that social connection that's so necessary. So doing things virtually is not, you know, I don't think any of us find it to be as good as meeting in person, but to reach out virtually, to make sure we make the effort to make social connections, to do socially distanced walks, for example, and to be aware. I think it's also easy if you're by yourself to not kind of check in and to not also have routines. So to put routines in your day. So to do all of the things that we spoke about, but especially to find alternative and creative ways to have social connectedness. Sanjeev, would you add anything else?
No, I think you've covered it. I think it really is about trying to bring that social connectedness within our virtual spaces and remote kind of connection where possible. And again, bringing it part of the routine. I would say sometimes there's really creative, the thing I mentioned, art of coping, and in our echo sessions, which is really our community sharing of how people are managing during this time. And a lot of them are very creative ways of connecting around hobbies and new activities virtually that provide some of that structure for people to connect, whether it's kind of virtual kind of reading groups, kind of art-based kind of services or interventions that are virtual. Any of those are kind of critical to have a sense of community.
The next question, I loved the mindful moment exercise. How often, how many times a day would you advise someone to do that exercise?
So I don't think it's, as a physician, I can't say there's a dose that I would say for sure that we could prescribe, a number of minutes per number of times per day. But I have to say, and I'll share my personal, is that it's difficult for me to build into my day, to be honest. And it's always for me to be mindful about how I can build that in throughout the day. Sometimes it's by participating and modeling this in programs or services, which allows me to build it into my own day as part of my work routine. But I would say it's something we need to do on a regular basis. Like, again, we think about, eating, sleeping, exercise. I would say mindfulness is part of that. And if we can do it once or twice per day, whether it's you wake up in the morning and you're mindful, there's even mindful walking as well that you can do. So you can get 2 for 1 if you really want to be efficient. Or end of day before bed, or really it's about how can you build it in at least one step at a time. And again, I would say any mindfulness is better than none. And so if we think about our SMART goals and how we can set some realistic opportunities to build it in would be great. But if you can build it in at least daily, that would be phenomenal. It has tremendous evidence and benefit.
Perfect, thank you. There are a number of frontline workers who are not in healthcare and are often not recognized, such as retail, forestry, and mining. Is the message and strategy different for these workers?
I am so glad that question came up. I meant to say earlier, this idea of essential workers, I think is important because we need to support people, but I think we also have to realize we're all kind of an ecosystem, and really everyone is essential. Everyone is essential, even people who are, staying home and not dealing directly with the pandemic. It's important because they are either helping themselves or helping their household. Sanjeev mentioned the art of coping that we use in our virtual education. Artists are essential. I've just done a whole series of interviews with artists who are helping us with that coherence piece, because they're helping us metabolize these experiences that we're all collectively having. So I think we have to question this idea of essential, but it relates very closely to another question on the chat around what we are doing for frontline workers, which I think should happen for everyone again. And I was thinking of an article that we didn't include this time, but one by a researcher, Tate Shanafelt in the US, who talks about what organizations should be doing for health providers. But again, I think it applies to everyone, and that organizations really, and he and his colleagues broke it down into 5, I just pulled it up here to remind myself, but like, hear me. So understand what people are going through, make time to listen. So for frontline workers, people working in grocery stores, their employers, their organizations need to make room and space to hear them, to hear their concerns, to protect them. Having PPE, we heard a lot about that, protective personal equipment. We heard a lot about that early on in the pandemic. People want to feel protected by their employers, whatever their profession or experience or job. Prepare me. So helping organizations, employers can help prepare people for how to face this. Support them, so providing resources, thinking about protected time, thinking about how things like holidays are going to work, long shifts, what other resources people need. And a sense of care is incredibly important. I think employees know if their organization, if their immediate supervisors, but also the organization generally has a sense of care and concern for them. And all of those things together are really necessary to help people feel supported at that organizational level. And I think we could extrapolate even further and think about, our governments, our local recreation programs, the people who are, the structures that are meant to support us socially. All of those same things could and should apply to them. Sanjeev, any?
Okay,
No,
how can
no, I think-
management help mitigate stress and anxiety for their employees?
So I think that's exactly what, like those things that I just mentioned. So management should make space to hear the concerns, whether it's a virtual meeting, whether it's a Dropbox of concerns that people can write in, kind of a no judgment comments section or process, making sure that there is protection. So very basically, like, are there, hygiene protocols in place to help manage? Are we thinking about, people's work days and how long they are, or when they've last had time off, for example, and asking people what they can do to support and showing that care. So all of those different things, I think management can take leadership to do.
The question 9. I'm a lightning strike survivor since 2013. I've been in and out of the psychiatric hospital for 4 years since the incident. As an Indigenous person, it enhanced my spirituality. For spiritual people like myself who suffer from mental health issues like schizophrenia, what advice do you have to help with stress and anxiety?
Sanjeev, do you want me to start?
Yeah, sure. Why don't you start, Alison? Yeah.
I think this is really important, and Sanjeev already talked about the need for mental health and mental wellness resources in communities, and we know that some communities are better resourced than others. I think it's also important when we think about that, we talked about coherence, but really that's like a sense of meaning, a sense of purpose, a sense of understanding what's happening to us, not just around the pandemic, but in other areas. And it's very important that that sense of meaning resonates with you, whoever you are, and whatever your cultural beliefs and values. So yes, I think it's very important to for all of us to acknowledge our own sense of meaning and spirituality, and to that can lend a sense of coherence. And those are real wellness tools that are very important this time. Sanjeev, would you?
No, I would agree. I would agree. I think, again, we didn't cover it, but spirituality is a core component to part of that resiliency and also connectedness as well, right? And thinking about, communities and how we're staying connected. So I just underscore all those points, Alison, that you've highlighted, and great point that was raised as well.
Oh, and one last thing around that. I collaborated with a colleague, Lisa Richardson. We wrote an article. It was initially in the Canadian Medical Association Journal and then Scientific American, about how First Nations, Inuit, and Métis communities have been coping during COVID, and using that sense of meaning and sovereignty and spirituality to help manage this pandemic in really powerful ways. So if anyone's interested, it's easy to find online.
What strategies do you have for those of us who are clear on what we need to do for health and balance, yet are unable to act upon it?
So, maybe I'll start with that, Alison, that again, I think it's probably one of the more common challenges, because a lot of us know or hear or read about what we should be doing in terms of our self-care and managing our well-being and mental health. It is hard to enact on it for a variety of reasons, whether it's time, feeling just tired and exhausted, whether it's not knowing where to turn and being bombarded with resources and not knowing where to start. And really, I hope from our session today, it really first validates the fact that it is a tough time and it can be hard to get started. And sometimes even starting with one thing that we can try to do to tackle our self-care, thinking about those C's would be useful, that there are something that we might be able to control, that we have a little bit of bandwidth to actually address. How do we even attend or monitor to kind of our care, whether it's sleep, whether it's starting with addressing some sleep challenges, nutrition, some of our social support or connectedness. So again, I would say just starting with committing with one thing that we could do. And also accepting and being gentle with ourselves, that we're not going to be perfect all the time and not being able to enact all this. And whether we can, if we're able to take even those first steps to help with self-care, it can go a long way to kind of rejuvenate that. I say, again, those mindful moments or those opportunities to think and reflect on kind of sleep or nutrition or exercise, just even a little bit of that. And Allison gave a great example of even this weekend, just that one moment going down to the lake for your flu shot outside was rejuvenating, right? I'm sure it had an impact for the weekend in terms of that experience. And so again, I think it's not, if we think about it as an overwhelming thing where we have to build into it every day, we have to do, you know, a half hour a day, it can be quite overwhelming. So again, starting small, setting realistic goals, and taking those initial steps are critical.
Not everyone follows safety guidelines and takes the pandemic seriously. Sometimes it can be an extended family. This causes stress and awkwardness. What tactics could you employ in managing the stress that is created?
So important, because it's true, we can't really control the behavior of others. I think it is really important to take care of ourselves, and sometimes that involves setting really challenging boundaries. I personally would look at that triangle first and say, okay, in that situation, so say it's like, you know, it's a Saturday and you have a family member who has a habit of dropping by, they don't wear a mask, they want to come right into the house. So I would look at that specific situation and understand what your feelings are, what your thoughts are. I can't say anything, I'm just going to offend them, I don't know what to say, and that might make you feel more anxious. And then and then look at what's the choice of action, what's the behavior. You know, you let them do it anyway, and then you have to contend with your own feelings. So you can intervene on any of those spots, but I would say immediately that an important thing is around the behavior, that you have to realize your own boundaries and find ways of saying something. And just, you know, I'm really trying to keep myself safe, or I really do follow public health guidelines, and I'm sorry, I need to ask you to do this. And if you don't feel comfortable, well, we'll see each other another time. It's really finding a way to recognize what's happening in yourself and why it's hard to speak out or set those limits, and then practicing it. Even role playing can help too. You know, practice it with somebody who say, look, I'm really having a hard time telling my uncle that he can't come in the house without a mask, and kind of go through, you know, how you would set a boundary. Sanjeev, do you have anything to add to that?
No, and again, there are some people, I mean, it's obviously important setting those boundaries, especially with those who are part of our support systems, or, you know, family or close friends. But there are also people you might be seeing in public who are, you know, you don't have relationships with. And again, I think it's about keeping yourself safe and your loved ones safe first, and also doing the best you can to make sure that you're not taking on things that you can't control. So it's not my issue, but I'm going to keep it as safe as possible, and really, you know, uphold the precautions that I'm most comfortable with at this time. And then also removing yourself from those situations if you need to, if you don't have control or can't set boundaries or have those relationships. That's, I think, part of the other kind of issue that I've heard come up with many people.
From a community perspective, are there any communities that you know about that have come together to address COVID-19 and the impact on families, community members? We can learn from other communities. Can we learn from other communities? Any suggestions related to activities, interventions at a community level would be great.
I can start a little bit, maybe, Allison, and just say that I think in various communities, what I'm aware of have been in a few general areas. One where communities have set up virtual kind of supports groups, or groups that might be focused around well-being, could be spiritual, as well as thinking about opportunities that are for people who are struggling in specific circumstances. I mentioned grief and loss. There's been many groups where individuals have come together, families of people who've passed away during COVID-19, who've really provided supports for one another. There are many services that have moved to virtual that provide opportunities to connect in more community-based settings, whether they're in kind of substance use treatment type of more professional contexts as well, but also ones that have come together led by patients and families as well, kind of bringing others together in terms of supports and networks. So I think there's a lot out there. I think the challenge is being able to curate them and understand and learn from them, just because so much of it has really cropped up innately and serendipitously in some of these circumstances. Allison?
Yeah, I would just tag team on that with Doris. You asked a question about examples for people keeping that social connectedness virtually that I think relates to this. And, we could give 100 examples, but I think reverse engineering it, asking the person or yourself, how do you usually like to be socially connected? And then try to find a virtual example of it. So for example, my sister and her husband are really into gaming. They usually got together, they played Dungeons and Dragons. They really were, that was a real creative outlet. Well, they have now found ways to do that online. For someone else, it might be exercise. So finding an exercise class or doing an exercise class with friends. I have another friend who loves dance. And she now meets with a group of people. And I always thought, well, that must feel really strange, but they really get a lot of power from it. They each dance individually, but together virtually. People have meals together, but just finding out or reflecting on what is your best way of feeling socially connected, and then actively going and trying to seek a virtual way to do that and try that out.
Okay, the next question. I support individuals with intellectual disabilities and feel as though I'm giving 110% to ensure they're feeling connected and receiving what they need in this time. With this, I find that I myself am feeling down and drained, and I'm giving them all I have and have nothing left for myself. What would you recommend for me to do to have a little time for me at the end of the day?
I can start with that one. And so again, a very common concern and experience for individuals. And again, kudos, Tanya, for posting that and the tremendous work you're doing during this time to support individuals with intellectual disabilities. I think this is a two-pronged approach. I think if you work within a team or an organization, I think the first step there are many ways in which we can start to think about how we can carve out time for self-care so it's acceptable and part of kind of team meetings or the organization's approach to mental health and wellness. And a tangible example is, within the teams that I work in, we schedule social events, for example, that are not work related for connection, because we don't have those hallway discussions or those ways in which we might have had through interactions in-person meetings where people are communicating afterwards, talking about some of the stressful things they're going through very casually as part of our daily workflow. We've lost a lot of that through our virtual means and more feeling a bit more isolated. So if there's ways in which we could do that through the organization, there's also kind of yoga, wellness activities, well-being that we can also incorporate in the organization. And then I would say personally, doing something at the end of the day, it comes back to an earlier point that Allison just made, is about identifying what gives you meaning, passion, what are aligned with your values, and in terms of activities or focus. So one would be kind of trying to think about something you might do at the end of the day that fills your cup or fills your joy. And again, there are many things we could go through, but it might be an activity or an experience or a connection at the end of the day. There is also that self-care, and so not to belabor the point, but also things like mindfulness or focusing on our emotional thermostat and how we can decompress during those times. So that's, as I said, mindfulness, exercise, making sure we're taking care of our sleep and nutrition, all important things. So I would say there's something to do for work, organization, something to do for pleasure and joy, again, aligning with our values and interests, and then self-care being another core component to that.
We also have an ECHO. We keep talking about ECHO, which is, it always has been virtual, even prior to COVID. And it's a virtual community of practice where people get together around specific topics on a regular basis. And we have one focused on adults with intellectual and developmental disabilities. So if you are a health provider of some kind, that might also be another source of support. I'll put the ECHO website address in the chat.
Next question. How do you weigh out the risk of COVID-19 versus the risk of mental health? For example, my father is 85. Do we have him over to our house as is a tradition, or do nothing and therefore he will be alone at Christmas? We all live in low case areas.
So Alice, I'm going to give it to you because you talked a little bit about holiday planning in a recent ECHO session that we had. So I think there's shared wisdom there. You might be able to share a few of the insights from that discussion.
So I think just generally, I'm going to get to this specific example in a second, but it is an opportunity to think about new ways of having traditions. So, we usually go down to the Eaton Centre in Toronto and look at the windows. But this year, I can imagine it's going to be really, people are going to be really in close proximity. So again, translating that, can we walk in our neighborhood and look at lights instead? So think about the things that usually give meaning to you and to your family over the holidays, and try to think about the public health guidelines and how you can accommodate those. We're also seeing different events being set up in ways that cohere with the guidelines, things online. There were Halloween things online, for example. But I do hear in this specific example some additional and very emotional challenges. So for older people who are already isolated, for those who may or may not have access to virtual means of connecting, what are the ways that we can either get them virtually connected, so delivering devices, showing people how to use them, doing visits outside the house. I think it is really important to maintain the public health guidance, even if those things are very difficult. At the same time, I also know of people who have literally a family plan, multiple households, to go into quarantine 2 weeks before the holidays and then get together on the holidays. So I think people are doing some creative things like that as well. And that's something each person will have to weigh up with their family. And then when you do get together, again, following all of those things, masks, distance, not having buffet style meals, those sorts of things. But not easy.
Okay, the next question. What advice can you give to volunteer first responders, such as firefighters, who leave their family or work when the pager alarms, immediately being thrust into a crisis? How can I manage that added stress?
I think, again, the stress of, again, the unpredictability of that, as well as some of the risks during this time are significant. I think it's, again, more about proactive and upstream type of interventions, right? So I think we know having access to support services. I think it relates to an earlier point about first responders as well, about mental health literacy and resources and education. I think that's important. There are a lot of great resources. There's stuff by the Mental Health Commission of Canada related to Mental Health 101, some work even through our CAMH websites about Mental Health 101. And so that people, again, it's about monitoring and being self-aware about the potential for the impact of stressful work, such as the work of first responders, and the disruption in terms of kind of their lives as well, and also the layer of impact and complexity with COVID-19. So I think that's the first step. The second is then making, again, available in a concerted way some of these resources and supports, whether it's peer supports, whether there are some professional groups and services, as well as access to more intense supports if there are specific kind of mental health complications that might result from on-the-job type of work. So again, I think it's a layered approach of awareness, prevention, and attending to that, opening the dialogue and awareness, which includes some of that training, and then having access to supports and services from peer to professional support.
Okay, and the last question is for you, Dr. Crawford. Can you share a few more examples of creative ways that people have used for social connectedness virtually? You gave examples of reading groups. Do you have any others?
I think that was Doris's question, which I tacked on the answer to last question. Sorry, I was reading the chat. But that was where I was suggesting maybe kind of going in the opposite route, like reverse engineering and thinking about what is the desired activity and then trying to find a translation online. You know, for some reason games are in my head right now, but finding ways to participate in group games. There are now apps to do, there's an app to do everything now. Apps to do that socially. I've seen gardening online. Our High Park Gardening Center had some gardening online, which struck me as unusual, but I think there's so much out there. I think it's really going the other way and thinking about what interests you and then trying to find a group online.
Perfect. Thank you, doctors, again for your time and your information and being available to answer some of the questions from our participants today. That's all the time we have for this session, and we hope you have enjoyed it. It's the first of 3 sessions planned. The next webinar for families and caregivers is scheduled for Wednesday, December 2nd, 2020 from 1 till 2:30 in the afternoon. If you're interested in participating in that webinar, you can register after this session ends at canadacollege.ca/webinar. And the third webinar, geared for older adults, is planned for January 20th, 2021 at 1 p.m. So stay tuned for more details on that session and pencil it into your calendars. In the meantime, after this session, you will be prompted to complete a survey on this session. This is our first session of the 3, as I said, and we're really looking forward to your feedback as we plan for the next 2. So if you could fill it out, it will pop up after this session ends. We really appreciate it. Thank you for joining us today, and have a great afternoon.